Germany has passed the threshold of 100,000 COVID deaths. Now, the latest wave of the pandemic is pushing new infections higher at a record pace and putting hospitals in some hotspots under severe pressure. Meanwhile, the EU will recommend a 9-month time limit for the validity of vaccinations for travel into the bloc. Well, joining us now, Sam Fazeli, Director of Research for Bloomberg Intelligence, EMEA. Sam, I could not be happier to speak to you because I have a lot of questions on, first of all, why we're seeing this huge resurgence. And if you go back to the 9-month travel that you need a booster, does it actually mean that, the vaccines work, but for a really limited amount of time?
Yeah, good morning, Francine, and thanks very much for having me back again. I think we have to think about this. First, I want to talk about the 9 months because it's going to be quite critical and interesting to see what the various countries actually do. Whatever the EU says, obviously national bodies have to make decisions of their own. But the question I have here is, what happens if a country is boosting only people above the age of 40? What happens if someone else is doing it above the age of 65? So I have to read the details, whether they've actually been able to give a time or an age limit on that. That has to be able to respect that. And that's going to be quite critical. If it's going to be 18 and above, then that's what the countries have to do if they want to have access to the European Union. So that's on the travel side. On the infection side, Francine, again, I keep saying that the vaccines were never designed or would never have been expected to be completely neutralizing against any infection from the virus.
Yeah, but Sam, just to help us explain how we've got to a point where Germany, that was relatively successful in putting in place public health measures at the beginning of this, and then, of course, the rollout of the vaccine and the relatively low death rate there previously, how Germany has become front and center in this battle against the disease versus other countries outside of Europe. What is happening? What is the dynamic at play there?
Yeah, so I've been trying to get my head around this a little bit. I've seen some new data come out of Qatar that suggests that you get pretty good protection against hospitalizations having been infected up to about 9 months, at least. That's how far the study has gone. But so I thought, but let's have a look and see whether there's a correlation between the background levels of infections across the countries and their response and relative numbers of hospitalizations, etc. And when you look at Germany, which of course we know they did really well, even if you add up their vaccinations to it, and assuming there's no overlap between infections and vaccinations, which of course there is, they are unfortunately at the very low end of the percentage of population potentially immune one way or another to the virus. So perhaps that's got something to do with it. I have to dig in a bit more, but I'm trying really to get my head around, is it about that? Is it about combination of vaccination and previous infections, which of course the UK has done really well because, I don't know if you could say that, but it's had a lot of infections.
Sam, I guess the critical thing for politicians is that it's easier to, manage to invite people that already have 2 doses of vaccine to get a booster than it is for the unvaccinated to get vaccinated with a first dose. What's the right strategy?
Yeah, I think the only way you can do this is by giving people incentives to get vaccinated. I think trying to create lockdowns for the unvaccinated or things like that is a bit tough. I think France perhaps had the best method in terms of if you want access to highly populated areas, entertainment areas, restaurants, you need to show your pass. I was at a restaurant here last night, and everybody who got into the restaurant had to have their pass checked. And it worked. Now, of course, the problem is that as a vaccinated person, I can still be infected. I can still be infectious. So that doesn't change that dynamic. What it does do is that it helps the country manage the pressure on its healthcare system, because assuming continued protection against hospitalization by vaccines.